pain management as a specialty, generally we are talking about chronic pain, pain that people have been experiencing for weeks or months, that there's not an immediate treatment for that's removed the pain. So there's a difference between acute pain and chronic pain. Acute pain is the sort that you get when you have appendicitis or a gallstone or a kidney stone, or you break a bone. And if you think about it, that pain, you know why it's there. And if you treat the cause, the pain will go away. With chronic pain, the problem is the pain is persisting, and often the acute treatment has already happened, but the pain is already there, or perhaps there isn't an easy treatment for that pain. Now, with chronic pain, we start to get the problem of the pain itself, but we also then get the effect of having this sort of pain playing on the body and the mind of people for a time. So with chronic pain, what you tend to also see is that people's sleep is disturbed, is that people's emotions are disturbed, and that people start to get some deconditioning because they're not able to do the physical things that they're normally doing and want to do. So it's a more complex picture. So if we look at chronic pain holistically, we should always start off by looking at lifestyle and surrounds for people. For instance, people who are suffering with spinal pain and are spending a lot of time hunched over their laptop working to deadlines, we've got to be aware that actually that might be a major contributor to their pain. And we should look at that before over-medicating or putting needles in. Beyond that, of course, we've got analgesic drugs. Most people know about them because they take them for their acute pains. So, you know, we've got our paracetamols and anti-inflammatories and opioids. Problem is with those drugs is when you take them all of the time for a chronic condition, often they've got side effects or there's problems with tolerances. So we've got to be very careful with drugs for chronic pain. Then there's injections and more involved procedures. Now they can be very helpful for the right indication, but it's very important that there's a careful assessment of what the pain is, what are the mechanisms of it, and therefore what it's more likely to respond to. In general, injections should be considered when there is a localized sort of pain and where there's a good chance that the mechanism for that pain, the reason for that pain, can be influenced directly by the injection. And it's also important that the patients are explained well what the expected response to the injection should be, what the expected time frame for response should be, what they should do after the injection. And it's important that whoever's doing the injection is technically very proficient. Yeah. Spinal cord stimulation is a very advanced and a very invasive therapy, because for those people in whom it's effective, what they have at the conclusion of it is a permanent implanted lead and battery system, similar to people having a pacemaker for their heart. It is unfortunately not something that blocks all pains. Otherwise, the treatment for pain would be very simple: put a spinal cord stimulator in and block all the pain. The pains that it can wind down are the pains that really shouldn't be there, that involve a wind up of the nervous system, of the pain nervous system. So they're pains where nerve pain is a really important part of the pain, where it's the nerves dysfunctioning themselves that is an important part of the pain. And where we think that there's what we call central sensitization in the spinal cord level to particular areas of the body. That can be after an injury, or it can be something like painful diabetic neuropathy, where lots of nerves have been affected by a disease. So I would say it is where there has been, where pain is localized to a region, and where nerve pain and central sensitization are really important components of that pain. Where it's not going to be helpful is something like pure knee arthritis. If someone has a very bad arthritic knee, then they need knee replacement. A spinal cord stimulator will not block pain from a very arthritic joint or a fractured joint.